Could you please explain why the AMH test is so controversial?
So the reason AMH test is controversial is first is AMH is a central hormone of female reproduction. Like we said previously, if you imagine female reproduction is orchestra, AMH is a conductor. So it plays most important role, which means you cannot ignore AMH as a molecule itself, as a role in terms of role of in fertility, and you cannot ignore AMH test, which is a test which measures how much AMH you have in your blood, as a tool for managing fertility. You cannot simply ignore. So, but the problem is there's very little understanding in the public, and even among healthcare professionals, even among scientists who work in the field of fertility, in terms of understanding of a female reproduction properly in terms of egg reserve or follicle recruitment. Second is a role of AMH in determining egg reserve or controlling the egg reserve. Third is a AMH test itself, the properties of AMH test, and application of AMH test for the different for different purposes. So we just jumbled up everything. We already know about the female fertility AMH and AMH test. That's all we know, and we're just tangling up everything. So female fertility can mean different things to different people. For example, when someone is not trying to conceive but want to have a child in the future, in 5 years down the line, 10 years down the line, 15 years down the line, fertility means very different thing to them compared to other women who's actually actively starting to conceive, and compared to other women who have been trying to conceive who did not have a successful pregnancy, which means they have infertility, compared to other group of women who are doing fertility treatment using IVF. So these are very, very different group of women, and they have very different purposes. And AMH plays central role in terms of determining their fertility and fertility management, but application is very different. You apply AMH tests in women who are trying to conceive in future, which is for future fertility screening and monitoring or fertility preservation, very differently to someone who's actually doing IVF. So without understanding, actually we're talking about different purpose of use of AMH, we cannot understand the role of AMH. That's why when we don't understand something, it's too complex, even for scientists, even for specialists, even for the public or patients, then we just ignore, saying, oh, some people are saying AMH doesn't play any role, but actually I used AMH for my IVF treatment. Or some say, AMH it tells everything about my fertility. I have low AMH, I got pregnant, and this is why you should ignore low AMH. So this is all entangled. So we need to disentangle and put everything in its place so that people can understand AMH as a molecule, AMH test, and application of the test. One of the purposes of this live stream was to do that.